my tummy and all of that, right? Taught up to 39 weeks and all that. So it was a lot of, it's very close to my heart, prenatal yoga itself. We are going to do prenatal yoga also after this. Yeah.
So we
No
have to
problem.
feel that we are
Yeah, I would highly encourage you put something in your tummy and do like those blocks or something.
You put lot of khichdi.
Khichdi, that's not enough. 40 pounds. You have to put 40 pounds and do prenatal yoga, right? And we are going to discuss how much the body weight and all. So I sent the. Okay, we are set with that. Excellent. So it's very. We might have learned a lot of these things in our high schools and in biology and all of that. And again, not subject expert, I'm going to say it again and again, but it's very technical. So that's why what Ashwini decided to do is she sent nice videos, and we're going to watch the videos for the male reproductive organs and female reproductive organs and all of that. So let's begin the talk. So it's a system, it's an organ system, reproductive system is an organ system which humans reproduce and bear live offsprings, right? The essential features of human reproduction are liberation of an ovum, internal fertilization of ovum by sperm, transport the fertilized ovum to the uterus, implant it, and form the implanting inside the uterus wall. Formation of placenta, cord to provide the nutrition, and up to the suckling of the baby, which means coming out also, right? After the baby is born, how to nourish and all of that. Now, we are going to stop here and project the male reproductive systems video.
I can use this one?
Yeah, please.
Yeah.
This is Bluetooth, I think.
Yeah.
Shobha, just turn on, or what do you do with this?
press and hold on this side.
Which one? Oh, okay. Ah, it's press and hold.
Is that a speaker?
Hold it forever? Okay.
For you, you have to hold it forever.
I know, that's what I'm saying.
For others, it's just few seconds.
I'm connected.
Yeah, you have to connect with the. It says Anil at Uma or something. It might have been. You can detect it through the. It's not connected.
Showing nothing.
Oh, okay. Why is it?
Do we have Wi-Fi here?
Well, we are using the Bluetooth. I mean, the personal
If it's
hotspot.
on mine, I can get one.
It's not working. It's on now.
Okay. This might be
Let's
sufficient.
do this.
Okay, let's see.
That should be sufficient. Why is it not working? No, hold on. What is this?
No Bluetooth device connected.
Yeah.
Searching.
Now it is searching. Because this was, we had to turn on the Bluetooth. Can you? Other devices, something is coming up. Maybe on off? You can just.
No Bluetooth device connected. Searching.
I'm saying it's again searching.
There is one more Bluetooth coming.
Oh, there is one more Bluetooth. Okay, let's try that one.
Can I open this?
Yeah.
My phone not connected.
Otherwise, I will turn on the personal hotspot.
It's called Easy Hack. Easy Hack.
Slides are there.
Easy, yeah, I see this. Yeah. Okay.
It's connecting, right?
Yeah.
Perfect. So let's. Yeah.
system. Let's begin by simply identifying structures that are important in the male reproductive system. These include the vas deferens, also called the ductus deferens, the penis, the testes, note that only one testicle is shown in this diagram, the scrotum, the bulbourethral gland, the prostate gland, and finally, the seminal vesicle. You have to have a basic understanding of location in order to understand function and how all these structures work together. We will begin with the testes, the male gonad. This is a diagram of a longitudinal section through one testicle, so you can now see what's inside. Notice that the majority of the testicle is composed of seminiferous tubules. These tubules produce sperm via spermatogenesis. But how? Let's take a closer look. In order to do this, we need to zoom in on the seminiferous tubule and take a cross section through the tubule. Imagine taking a garden hose and cutting it in half. This would be similar to cutting the tubule in half and looking at what's inside. The lumen of the seminiferous tubule is lined by cells called Sertoli cells. These Sertoli cells are connected via tight junctions. Lining the outside of the Sertoli cells is a layer of smooth muscle. Outside of the Sertoli cells are the Leydig cells. These are all the cells that are really important. In addition to these structures, you will need to be familiar with the following compartments: the basal compartment and the luminal compartment. These compartments are basically talking about regions of the cross-section. If we are talking about the basal compartment, we are talking about the area that goes from the tight junction toward that smooth muscle. And if we are talking about the luminal compartment, we are talking about the area that goes from the tight junction toward the lumen. Now that you are familiar with the structures, let's focus on their functions. We begin with the Leydig cells, also called interstitial cells. The Leydig cells secrete testosterone. The Sertoli cells support sperm development, or what is referred to as spermatogenesis. The smooth muscle surrounding these Sertoli cells allows for peristalsis. This process is important as it will propel sperm through the seminiferous tubules. Well, that's all fine and dandy that the Sertoli cells produce the sperm, but how do the sperm get out of the seminiferous tubules and out of the testes? This is our next goal. So here are the sperm in the seminiferous tubules. The sperm has been produced by the Sertoli cells and released into the lumen of the seminiferous tubule. Those sperm then travel through this little region here called the rete, testes, and into the efferent ductules. This is the point at which the sperm exit the testes. From the efferent ductules, the sperm enter the epididymis and will ultimately make their way to the vas deferens. So that is the pathway the sperm are taking to get out of the testes. What propelled the sperm through all those structures? Peristalsis. Now the sperm are in the vas deferens, right? The vas deferens connects with the seminal vesicles to form the ejaculatory duct. At this point, the sperm is mixed with fluid that came from the seminal vesicles. The ejaculatory duct penetrates through the prostate gland to join the urethra. As such, the sperm wind up in the urethra, which receives substances from the bulbourethral glands. Thus, both urine and sperm are in the urethra. So that was just the pathway that sperm take from the seminiferous tubules to the urethra. Now, let's look more closely at the accessory glands I mentioned earlier. The seminal vesicles secrete an alkaline fluid that contains fructose, enzymes, and prostaglandins. Remember, alkaline fluids are basic. The purpose of this alkaline fluid is to neutralize the acid that is in the female reproductive tract. The fructose is used for energy. Remember, sperm have to swim, so they need energy for motility. The enzymes in the fluid facilitate semen clotting. There are also prostaglandins in this fluid. These are for motility and viability of the sperm. The prostate gland is another accessory gland. The prostate gland secretes citrate, which is an energy source for sperm motility and enzymes that will break down the semen clot once it is in the female reproductive tract. Okay, so take a second to make sure you understand. The semen clots during ejaculation and is then broken down once it's inside the female reproductive tract. The last accessory gland is the bulbourethral glands. These glands secrete a fluid that contains mucus. Why is mucus important? It serves as a lubricant.
A second.
Yeah, second.
Okay, in this segment, we're going to be discussing the functional anatomy of the female reproductive system. Okay, so before we begin the functional anatomy, we're going to just look at some characteristics of the female reproductive system. So keep in mind that there are cyclical changes that occur via the menstrual cycle and menstruation. There's periods of restricted fertility, and that is occurring during ovulation. And females have a limited gamete production. In other words, females are born with a set number of oogonia. Oogonia, these are the female gametes. Females are born with a set number. All right, we don't make more oogonia throughout life. This is a pool that's established at birth, and that's all the oogonia females will ever have. Okay, so now on to the functional anatomy of the female reproductive tract. All right, so to begin with, let's look at the location for the ovaries. And if we just take a look, so these are, there's two ovaries, right? We have bilateral symmetry. So if you divide this image in half here, there's an ovary on the right and one on the left. So we're gonna zoom in just on one of these ovaries here. And when we zoom in on this ovary and we look inside of it, what's going on within this ovary is that you have follicles, and within the follicles, they will contain developing ovum. We're going to talk a lot more about that when we get to the menstrual cycle. So for now, think about the ovaries in terms of the location for the developing or the maturing ovum. Once that mature ovum is ready, it will leave the ovary and it'll travel into the uterine tube. If fertilization is going to occur, it occurs in the uterine tube. We'll put a big X. X marks the spot. That's where fertilization takes place. Then either the zygote, if it's a fertilized egg, correct, or the mature ovum, whichever the case may be, will travel to the uterus. If it is a fertilized egg zygote, that's going to be implanted into the wall of the uterus. I'll just put a Z in the wall of the uterus. If the developing, or the mature ovum rather, is not fertilized, it's going to continue to pass through the uterus, through the vagina, and out of the body. So that gives you a nice little overview of what's going on in the female reproductive tract. We're going to be looking at details for each of these structures and looking at how hormones are related and how that ovum develops, how the egg gets fertilized, and if it does get fertilized, how the fetus develops. So we're going to be hitting each of those in separate video lectures. Okay, so these are the functions of the granulosa cells. For right now, you're not going to have a clue what the granulosa cells are, and so when we discuss the menstrual cycle, please be sure to come back and look at the functions for the granulosa cells. Okay, now continuing on then with the reproductive tract of the female. So we're going to focus momentarily on the uterus as well as the vagina, and I'm not going to go through and read all of this information to you because you can read it. What I want to focus on is the wall of the uterus. There's 3 layers to the wall of the uterus. There's the outermost layer called the perimetrium, and that has epithelial cells and some connective tissues. There's a middle layer called the myometrium, so you know that's composed of smooth muscle. And then the most important layer of all for us is the endometrium. And I say that because when we discuss the menstrual cycle, we'll be talking a lot about the endometrium, the innermost layer of the uterine wall. And then of course over here is the vagina, the female organ of population. Lots of smooth muscle associated with that, and lots of glands. Okay, so I'll let you read the rest of the information on these slides. So then we move into the uterine tubes, or also called the fallopian tubes, also called the oviducts. Be sure that you're familiar with using any of those terms. Now, we talked about the ovum and how it matures in the ovary. So here we have the mature ovum. Okay, and you don't quite yet have details on how that happens, but you will soon. So once you have that mature ovum, it gets transported to the uterine tube and then to the uterus. So this would be the uterus over here. And remember, the uterine tube is where fertilization takes place. We need to talk about the infundibulum and the fimbriae. The fimbriae are these finger-like projections. The infundibulum would be located right above the fimbriae, and they help pick up the ovum that's been released from the ovary. So once that mature ovum leaves the ovary, the fimbriae and the infundibulum, they're going to help move that mature ovum into the uterine tube. And that's done through mostly peristalsis initially, and then it turns into ciliary action that moves that ovum through that uterine tube. And it takes about 4 days for that mature ovum to reach the uterus. So that concludes this segment.
So while we are setting it up, what is peristalsis? Yes, where else do you see food digestion as
Esophagus.
esophagus from all the way to the colons, right?
Was that on YouTube?
Yeah, it's on YouTube actually.
What was it called? Human physiology something?
We can send the links to you guys. So we're going to skip through some of the slides here, which we have gone through, and we'll go to the main things to know for us as a when we teach classes, not just as a therapist, right? What are some of the complications, right? There are, as we will go through, male reproductive system disorders. Hydrocele, a fluid-filled sac partially surrounded the testis, swelling on the side of the scrotum. If it causes discomfort, then it can be surgically corrected by urologists. So if you hear anything like hydrocele, means there is some issue going on. Cryptorchidism, hidden testicle. It is a very, it's like childhood thing, as if the testis doesn't fall into the place, and it can cause problems in childhood itself for the boys. So before puberty, it can lead to sterility and also increased risk of testicular cancer. Okay. Benign prostatic hypertrophy, BPH, swelling. So we kind of visualize where the prostate glands are, right? So a lot of time, as the age, you might have heard a lot of people saying, I have, this person has an enlarged prostate gland, which means there will be problems urinating, there will be, and that's through aging. But during the childbearing, the fertile years also, problems of infertility causing in the males. So all of these are related to that as well. Okay, and as you can see, BPH becomes more common as men age. Prostate specific antigen, PSA, is a marker protein for prostate cell secretions which can be detected with a lab test. A rising PSA may be a sign for some of these problems like cancer and all of that. Okay, so few more disorders: erectile dysfunction. Many times it can be a problem with fertility, male infertility also. Persistent difficulty achieving the maintaining, and causes are usually medical but can also be physiological. Organic causes are usually the result of an underlying medical condition affecting the blood supply. Male infertility can be due to low sperm count and undeveloped sperms, lack of sperms, and autoimmunity as well. Okay. And this can also be related to diabetes. So yesterday we learned about diabetes, and I have very close relative in our family who had diabetes very early stage, and also low sperm count and all of that, and probably they didn't have kids for a long time, and even they don't have. Okay, so testosterone deficiency, also known as late onset, and it's a clinical and biomedical syndrome that occurs in men in association with advancing stage. So testosterone is a hormone, exactly. So that's okay. We watched this enough, so we have an idea of what happened. Okay. I'm going to skip these slides. Now we will go directly into the disorders, some of the disorders, right? And so it's very interesting to know, because before we go into the disorders, where does the fertilization takes place? Yeah, it takes place in the fallopian tube, and it doesn't happen right in the uterus, right? And what are some of the complications, if you have heard of any complication? Tubal pregnancy, ectopic pregnancy. The implantation happens right there, and there is no space to do it, and the person has to go through a surgery and sometimes remove one of the ovaries and one of the tube. They cut it off. So, and then it's very hard to get pregnant and all of that. So anyway, so it's kind of nice, it just makes wow, all these things happen, and then comes and it implants into the uterus. We'll look into that. There is a whole process we're gonna. So now disorders. Endometriosis. Where is the endometrium? Which muscle is the endometrium? We just looked at the video, right? It's in the uterus. It's the very inner lining, right? So now what happens is, similar kind of muscles start growing outside the uterus or any other part of that middle body. And endometriosis is, so what happens when there is a endometrium in the places other than uterus? It also starts, the person starts bleeding because it has to shed, right? So that kind of endometriosis is heavy bleeding, and it's not just from the uterus, it can come from any other areas, and again traced back to stress and all of that. So we will look into that. Uterine fibroids, gynecologic cancer, HIV/AIDS, polycystic ovarian syndrome, very, very common, right? PCOD, PCOS, we see a lot of such patients, and sexually transmitted diseases, right? So endometriosis, as we said, is the kind of tissue that normally lines the uterus grows somewhere else. It can grow on the ovaries, behind the uterus, on the bowels, or on the bladder. So we kind of visualize where they are, right? They are like almost in line. So there's uterus, there is the bowel is the colon, that last part, and the bladder. So, and it may cause infertility, heavy periods, and all of that. Why I'm mentioning this is, it's very common. In the last 20 years, we've been seeing so many of these cases. And in allopathy, typically they have IUD. They put IUD so that they don't bleed heavy and all that. And that can be a complication too, so we can see all these things. Now, uterine fibroids, what are those? Non-cancerous tumors in women of childbearing age. Fibroids are made of muscle cells and other tissues that grow in and around the walls of the uterus or womb. And again, signs are heavy periods, fullness in abdomen, and all of that, right? Gynecologic cancer. Anything related, cancer related in any of these areas, right? The reproductive system areas. So those are the. Cervical cancer begins in the cervix, which is lower, narrow end of the uterus. That's also pretty common nowadays. Ovarian cancer, all of those. HIV/AIDS, human immunodeficiency virus, HIV, affects specific cells of the immune system and they can be sexually transmitted. PCOS, ovaries or adrenal glands produce more male hormones than normal. Yeah, so some of the symptoms, people can, you can see more hair growth on the facial hair sometimes. That can be, yeah, so those are complications, right? And it can cause obesity. PCOS typically, it's a slowing down of metabolism too, and we have seen that. And plus there are some medications that they give along with that, and which just typically PCOS causes, people with PCOS are obese, stress, genetics, and all that. And by the way, I don't know what is this happening. Vyasa, our Nidhi, right? Raghuramji's daughter-in-law, she did her PhD was in PCOS in young college-going children between 14 to 16 and all that in the city of Tumkur, very close to Bangalore. So she had the clinical trials and all that. Her research paper was on PCOS to show the symptoms in 3 months, how the symptoms of these things came down. And okay, now again, symptoms can PCOS may cause infertility, right? Excessive hair on the face and all that. Okay. Sexually transmitted diseases, who having sex with someone who has STD causes bacteria and all of that, and there's a whole different science on that, right? So I'll leave it. So male hormones, testosterone, gonadotropin releasing hormone, luteinizing hormone, follicle stimulating hormone, and as you can see, they are all important for the fertility, right? So female hormones, estrogen, progesterone, FSH, LH, inhibin. And we'll go into a little bit further detail. Okay, now we in the video also we looked at some of the things, but something to look at is the cell division, right? The spermatogenesis. When it happens, the cell divides and chromosomes they get split from 46 to, so it's called the meiosis. I think it divides into 4. The cell meiosis is cell divides into 4 and then the chromosomes split into. I'm not sure how it happens with the 46, but just remember that half of the markers, genetic markers, the division happens over there. Okay, so the next is the ovum, and similar thing happens here, right? So containing 23 chromosomes, and then the menstrual cycle, we have looked at it. Something to note is there are the days, right? Secretory phase, endometrial lining preparation for implantation lasts 10 days. So in the next, I think we have somewhere. Yeah, so if implantation doesn't occur, estrogen and progesterone decrease and endometrium dies, resulting in menses, right? So next few slides will be focusing on the fertilization, implantation, and the stages of fetus. Okay, so we looked at in the video already, and something to look into is the 14 days before women's next menstrual period is the fertilization time, right? And at the time of ovulation, the ovum is released and it remains in the tube for 48 hours, the unfertilized, right? So the ovum remains for 48 hours. And then another thing to look into is the 72 hours thing, right? Where the sperm can be viable, means it can be alive for about 72 hours. And if the fertilization occurs, then the fertilized egg comes down, and so something to note here: there are about 300 million sperms in the ejaculation, but only takes one sperm, right? Okay, now something to look into is the fallopian tube, right? Where we said zygote will remain. Zygote is a fertilized egg, yeah, before it travels to the uterus, where it will remain for about 4 to 5 days floating, and then it implants. Then it finds its way. And there are some things when the fertilized egg is growing, right? So we will look into that. Okay, so another thing very interesting, right? So these X and Y chromosomes, and sex of the offspring is determined by whether the sperm contains X or Y, right? X or Y sex chromosome. Female always carries a X chromosome, which means the sex of the offspring is always determined by the sperm, right? Okay, I think it's the same.
When they were educating like about who determines the sex of the baby, not the, because they were always getting them all. So even Durasan used to show this.
Yeah, that was one wow thing when I did my
Yeah.
biology first. First I was like, okay. Anyway.
Exactly.
For having given birth to a girl.
Exactly.
Yeah. Okay. Now, so next is our topic of importance, right? Because we are going to do prenatal yoga very soon. So now we need to know what happens through the 9 months, and that's what it is.
We all have a good baby.
Yes, we are going to have you are all going to have. Yeah, floats in the uterus for about 3 to 4 days, gaining in the size and weight as it burrows into the uterine lining. Okay, so the villi of morula also manufacture human gonadotropin hormone. That's a hormone which signals the ovaries to continue to produce the progesterone and estrogen to prevent menstruation. So the first 2 to 3 months, actually first 6 weeks, there are lots of tests done to see something. So what is that something? Is these hormones. They do a blood test and see. If the hormones are not produced enough, then there are complications. The child may not be implanted, right? So when the lady goes for the test, that's what they're measuring. If they have enough, which means that the area is given enough nourishment for the fertilized egg to grow, right? Otherwise, there is miscarriage and all of that. Okay, implantation normally occurs in the upper posterior wall of the uterus, and that's also very important because we'll come to some of the complications in placenta previa and all of that. So it's usually, I had one picture here, and that's kind of nice too. Projector. How do I do this? Fast.
It's a PowerPoint.
Yeah, I don't know how.
Oh, if you do the slideshow, it will come.
How do No, this is from the internet, right? I'm just trying to show one of the internet, this page. I cannot project like that, right? Or window, okay. No, I don't know. Okay, no worries. We'll. So the placenta is a fleshy disc-like organ completely formed by the 3rd month of pregnancy. The cord connects, and that's the nourishment line, right? That's the nourishment pipe to the baby. And it's 20-inch long, almost 2 feet, right? And 3/4 inch in diameter. And placenta is the food sac, right? And the cord is the passing agent. That's how you have to remember. Okay, so a few more things here. Placenta transport mechanism between embryo and the mother, transports oxygen, nutrients, antibodies to the fetus by means of that cord, right? It removes carbon dioxide and metabolic waste from the fetus by the 2 umbilical arteries. So there are veins and arteries and the beautiful connectivity. Serves as a protective barrier against harmful effects of certain drugs and microorganisms. So it's a very, very nice protective, there's a fluid and all of that, right? There is a one complication that comes, and that's why we need to know. Serves as a, acts as a partial barrier between the mother and the fetus to prevent fetal and maternal blood from mixing, and we'll come to that in one of the complications ahead, if further. Produces hormones essential for maintaining the pregnancy. Okay, fetal membranes. 2 membranes line the uterine cavity and surround the developing embryo fetus. The amnion, which is the innermost, and the outer membrane is the chorion.
Where the HCG is secreting from? Is hypothalamus or is coming from placenta, or it's coming from hypothalamus affecting the placenta and then it's being available in uterus? How the HCG is?
You mean the hormone?
Yeah.
How is the hormone?
Yeah, where it's coming from? Is it coming from hypothalamus going to the placenta, or is it secreting from placenta? I think in the previous slide a little bit is there.
This one, right? Okay. Placenta produces hormones essential for maintaining the pregnancy. It seems like placenta is like, its own brain. It seems like, I mean, that's what I feel, because it's, it's independent of what is going on here, right? The baby has to be still nourished regardless of what is going on in the mother's hypothalamus and all that. Placenta is like all by its own. But I can check.
Can you check on that? Because I think
Yes.
I'm still doubt that estrogen, progesterone and HC is being produced by placenta. I think it's coming.
Yeah, no, it says placenta produces hormones, all the hormones that are essential for maintaining the pregnancy. It seems like there is a total different environment, world for the baby, and so it's regardless of whatever is going on. But I will check as to how placenta and the mother's the brain functions are related. It's a very interesting question to see. I will check on that. Okay, so functions of the membranes: protect the fetus from direct trauma by disturbing and equalizing any impact the mother may receive. Any like physical impact, right? That's what we are talking about. Separate the fetus from the fetal membrane. Allow freedom of fetal movement and permit musculoskeletal development. That's why the stretching and all that happens, right? Baby can grow. Facilitate symmetric growth and development of the fetus. Protect the fetus from the loss of heat and maintain a relative constant fetal body temperature. Serves as a source of oral fluid for the fetus. So everything, like as Vishwambar said, it's a whole different world there for the baby, right? So it's like
I don't have any experience, I'm just.
You have the experience as a baby, but you don't remember.
yeah,
Yeah, you
good
were a
one.
baby somewhere.
Yes, as a baby, but can even regress to that, right? I mean, pratiprasava. So we can go back to that. That I mean, the sages probably will kind of trace their lives to that womb life, right? Or even beyond. I mean, what is womb life? Yeah. So anyway,
So comfortable.
so comfortable.
No, it's not comfortable.
No, not for mom, for the baby.
No, even baby, it is not comfortable. Imagine in that much space.
Yeah.
That's why Prajigovindan, Mundarapi Janana.
Yeah.
Janani Jatareshan.
Yeah. Act as an excretion and collection system also. Okay. Okay. Now we're talking about the first trimester. During the first 3 months of pregnancy, what all happens? The production of the product of conception grows from the just visible speck to the fertilized ovum to a lively embryo. So you can see some parts, right? All organs are formed. Fetus becomes less vulnerable to the effects of most drugs, infections, and radiation. Facial features are forming and fetus becomes human in appearance. So that's why after 3 months, you typically our prenatal yoga, that's when the mostly 10 to 12 weeks they start coming in. The women start feeling a bit better, all of that, while not losing weight and all that. We'll come to some of those. First trimesters continued here. External organs are visible, but not the sex organs are visible, but still difficult. Well-defined neck, nail beds, lining, and tooth buds form. Rudimentary kidney excretes small amounts of urine into the amniotic sac. There is movement, but not just strong enough to feel it. Fetus is about 2.9 inches long and weighs about 14 grams. Second trimester. During this phase, the fetus into a miniature baby, turns into or becomes a miniature baby, right? Fetal heart tone can be heard with a stethoscope right from the stomach, right? Skin is wrinkled, translucent, and appears pink. Sex organs are well formed and visible in ultrasound, right? So usually that 16th week. Skeleton is calcified, which means little hardening is happening there, right? Birth survival is possible, but the fetus is seriously at risk if premature babies, right? So if something like that happens. Third trimester. So I'm assuming we all know that 3 months, right? Trimester means first 3 months, second 3 months, and third 3 months. At the end of third trimester, the fetus skin is whitish pink, hair in single strands, testes are in the scrotum if the male child, bones of the skull are firmer, comes closer at the suture lines. Lightening occurs. What is lightening? Do you know? Turning down of the baby. Yeah. Fixing, the head fix and all of that. So lightening occurs. Fetus is about 20 inch long, weighs about 3,300 grams. It's about 3.3 kgs, right? Okay. Amenorrhea, cessation of signs, and now we have to. So why is this important even in the AYTT class? Right? So imagine if you are teaching for 15 people and one lady doesn't even know that she's pregnant and she comes into the class. What do? AYTT or any yoga class for that matter, right? So we want to know some of these things, and we want to always say, well, if somebody, you take those waivers and you talk to the person already and all of that, but many a times until like say 6 weeks or so, 5-6 weeks, lady doesn't even know that she's pregnant, right? Anyways, so signs of the pregnancy is amenorrhea, which is no menstruation, right? So suddenly missed period. Yes.
I have seen women, they are 6 months pregnant, they don't know even they are pregnant.
No, you will not know. They will know, right?
No, they don't know. I have a
They don't
family
know.
member, 6 months and she didn't know. And after
So
2
no
months,
missed periods.
No.
She didn't have missed
she
periods.
has twins, I don't have
No, no, no. But did she have missed periods?
Oh, I didn't ask them.
Ah.
Actually,
Maybe
my
after now.
cousin, she did not like the period she got until 9 months.
She got periods.
Yeah.
Yeah,
So,
that's why.
so until 6 months, she doesn't know she was pregnant.
So it's not very typical, right? These are very special cases.
Yeah.
So yes, we have to know all of these things. And many a times, trust me, if you go to the non-Indian community teaching yoga classes, they are so, outgoing, and Sukhi is nodding so much. I know some, they can do so many things. They do so many things. And by the way, if you have been doing yoga and if you get pregnant, up to 4 or 5 months, you can do a lot of stuff. Only the prone poses are a bit hard. You can do a lot of stuff. But can you teach those to your clients? Maybe not. I'm going to suggest highly not. Right? We're looking at so many complications and liability and all of that. If you're teaching a AYTT class, it's not a prenatal class. It has to be a prenatal class, and we'll go through. Okay. So now nausea, vomiting, gastrointestinal disorders. The body becomes very relaxed, the muscles and cells, and they become more relaxed, which means that the peristaltic movement also slows down, which means the constipation is very common, and also more frequent urination, because the area where the uterus is pressing against the bladder feel like going to the bathrooms more, right? Infections are possible in the first, especially in that first trimester when everything is forming, right? And yes, anxiety, emotional upset that first trimester. Okay, physiological changes as we talked about, frequent urination, infection, fatigue. So skin changes, some of them, right? Okay, this is interesting. Blood volume increases gradually by 30 to 50%. This results in decreased concentration of RBC and hemoglobin. Iron, that's why the more supplement, the iron supplement is given, right? The cardiac output increases. We talk about the yoga and cardiac output and all. 30% during the first and the second trimester, which means the temperature rises slightly, right? When the blood is doing, when the body is doing a lot of work, which means slightly there's a temperature rise, and that's why feel hot, right? Yeah, respiratory rate also rises to 18 to 20%. 18 to 20 to compensate for increased maternal oxygen consumption, which is needed for the demands of uterus, the placenta, the fetus, and all of that. Signs and symptoms of pregnancy continued. Venous return will be poor, and that's why there is a swelling in the feet and all that. But unfortunately, we cannot do any inversion that time for them. We cannot do any inversion. But we will see how to work on that. Supine hypotension means you cannot lie on the back too much, right? Which may cause some complications of feeling dizzy, nauseated, and it inhibits the return blood flow in the blood vessels, and that's why it's not recommended. Supine positions are not recommended unless you are in the hospital, right? Where you are lying down. Slight increase in body temperature, we talked about that. and sort of hot flashes caused by increased hormonal level and basal metabolic rate also, because the body is working a little more to feed the zygote. Okay. Spine and digestive system. Realignment of the spinal curvature during pregnancy to maintain balance due to increase in the size of uterus. The sort of center of gravity shifts, right? The back pain is a very common thing that is experienced. Peristalsis is slowed down, as we said, so slightly, everything is slow, which also means that heavy foods are not recommended, right? Eating too much, you cannot digest. Yeah, constipation and all of that. Okay, emotional stress, especially in the third trimester. Okay, endocrine functions during the pregnancy. So parathyroid gland increases in size slightly to meet the requirements for calcium needed for the fetal growth. This is for the mom, by the way. Posterior pituitary will begin to secrete oxytocin that was produced in the hypothalamus toward the later stages of pregnancy. It will serve to initiate the labor, so that sometimes it's artificially induced, is it? Anterior pituitary at birth, this will begin to secrete prolactin. This will stimulate the production of breast milk. Placenta acts as a temporary endocrine gland during pregnancy. Yeah, that's the answer we have. It produces large amounts of estrogen and progesterone by 10 to 12 weeks of pregnancy, and that's the test which I was talking about, right? I think this slide has come again. Serves to maintain the growth of the uterus. Yeah, that's a repeat slide. Weight gain, and that's what we are going to put in our tummy today, right? Up to, actually, it is 24 to 30, but it goes to, it is not just 24, it's 25 to 45. Somewhere I have read, and it might be 30 is less, because my own personal experience, 45 pounds. So anyways, so it goes up to that much, and imagine all of that. I'm asking men here to imagine, because women and these girls to imagine, because all of us have imagined, or we have experienced. There's nothing to imagine.
We already went through that human development course in the school.
No. Imagining 45 pounds in the tummy and doing your activities around. That's what I'm asking you to imagine. Okay, so which also means that if it is anything less or anything more, like say 60 pounds, 80 pounds, it's quite a bit. And that also includes the weight of the placenta and all of that as fluid. It's not just the baby itself. So there is a slight loss of pounds during early, and then it gains. And what I also meant is the baby's growth may not be efficient if there is not enough weight gain, right? Okay, that's the dropping, lightening, descent of the fetus into the brim of the pelvis, so that it's an easy passage after that, right? False labor, that also can happen before, closer to the delivery. Sure, this is when the blood-tinged mucoid vaginal discharge becomes more pronounced and dilation increases during the labor. That's the labor. We're talking about the labor. How is that?
Light action.
Light action, yeah, lightning.
And show also is a show.
It's very close to the labor, as you can see. These are all the signs of labor, right?
So what exactly is labor?
Labor is when the baby is ready to come out. So in hours period, right? That's approaching labor. Labor means
It's when you start getting contractions.
contractions. Yeah, when you start getting contractions, when active time, when the baby is trying to come out, and then the mother is have to aid. And that's why in the prenatal classes we talk about not going against it, right? Because when you breathe more, then your baby, because both, it's not just you want to get it out, the baby wants to come out on its own too. It has decided on that particular day to come out, and now you breathe through it, So it's not and we always say that pregnancy is not a disease. A lot of people, as soon as I'm pregnant, oh, I cannot do anything. I'm right here, that's it. So it's not a disease. It's a time to enjoy and all of that.
It
So it's
becomes
very
a sort of disability by the state. Exactly.
yeah, that is true. That is correct.
And recently they have, I think, found out or figured out, one of the machine where the men wants to feel the labor pain. Then they have made a studio where all the men can go and experience what the labor is actually feels like. So they give that put in their in their fingers and things, and they give the kind of shock therapy kind of thing. And they can experience how the labor.
God, I mean, but still it will not go any close to what it is, right?
No, they have exactly simulated exactly how the labor happens. That's how they have invented that particular machine.
Wow.
Because men do not have any idea. Notice how we scream, they don't have any idea what's going on there.
Yeah.
So
It's really painful, but it's enjoyable too.
enjoyable after that, not the labor is enjoyable. Oh my God. No.
Once you have the baby, you
Then it's
forget.
the whole bliss,
Yeah,
but before that is no.
It's a quite a bit of work. Yeah, it's like a rebirth. Actually, in the traditional way of birthing, right, like the labor and all of that. That's why the first 6 weeks and all that, it's given rest, which means it's like every cell in the body has gone through a trauma of this whole process, right? And that takes, like injury, it is an injury. After the childbirth, it's an injury. So if you have a surgery, you have a rehabilitation, right? So you kind of rest and all. It's the same thing. So encouraging in the classes for women to accept, because that acceptance will not come just like that, right? The postnatal blues and all of that. So we all go. I mean, the women typically goes through that blues, depression and all of that.
Postpartum is a really big deal nowadays.
Big deal. And nowadays, yeah. Those days, the whole society was there, and somebody's like talking, helping, everything was going on. But those blues and all of that, and we have to, when you have a prenatal class, when you teach a prenatal class, it's very important to bring all of these things to them.
I think it's easy for the women teacher to do that, rather than
Prenatal
us.
class?
There is no way, there is no connection at all. How do you know? Both are.
But when you go through that studio, the feelings.
Shailesh taught some prenatal class, I think, in the Milpitas, right? Yeah, Shailesh did.
Special man just to use your pregnancy
We can do whatever we want. It is those, the students, right? It doesn't matter what.
No,
We
you
are
should be
100%.
45 LPs, like 45 LPs, then you should feel like teaching.
We can teach whatever we want. It is the students who should accept us.
Yeah, no, but it is not like the male and female specific nowadays. Prenatal yoga can be very well taught by men also. But as Vishwambar said, it's naturally, you feel like going to a woman teacher, prenatal yoga, than a man teacher. But it's changing. It's changing.
They won't be that comfortable either.
But to make a counterpoint, if we compare this with, say, low back pain class, it doesn't mean that the teacher has to go through a low back pain and then start teaching.
That's true.
So we don't need to be
Pregnant.
experiencing that in order to, it's like a coach. That's a counterpoint. I'm not saying I'm arguing, but
Yeah, you don't have to go through that, but if you go through that, you will be a better back pain yoga teacher.
If you are mentally
But
in
I'm
their shoes, mentally even you are in their shoes.
Yeah.
That's very important.
With the
how
compassion
much you can adapt
and,
that they're a part of it, and then you can simulate exactly.
Yeah, compassion. It's
Yeah.
more of a compassion piece,
I
right?
think that is for everything.
That's
for
for
Yes.
everything. You don't
Yeah,
have
if you
to
just
go
go into mentally and then
whatever
space,
your now, student is going through.
By the way, the participants have to be comfortable with you, and you have
it is the
to
opposite
be.
side of it, which is what I'm saying. Not us.
They
We
have
are
to be
100% there and
comfortable.
do
Yeah.
everything we can. If they don't accept us in terms
You can
of
try.
everything he's saying,
You
there's
can
a-
try and see.
No, with your gesture, with your connection, with your mental thing, you can make, you can
Sometimes they
bring
love.
that atmosphere that
Yeah.
they will be comfortable.
I'm going to highly
But it never
encourage
started.
all of you
Not
to
sharing
shadow these prenatal yoga classes everywhere. We have one in, and again take the position, talk to the teacher first, go a little bit early, talk to the teacher, sit through there, and once in a while you can substitute those classes as needed. No issues at all. We encourage our participants also to accept any teacher in that way.
Yeah,
So
it was hard for
we-
me to teach the prenatal classes. I substituted few classes. It was hard for me.
It is hard, but
yeah.
we will do it soon. Okay, now burst of energy. There is increase in energy and all of that. So it's more of a labor, science of labor. Again, we need to also know these things because again in a prenatal class, you're teaching a prenatal class. That woman decides to come at 40th week and all of that. Things you need to slightly know all of these things. Okay. Possible complications during pregnancy. The gestational diabetes, we did discuss a little bit yesterday. So, during the pregnancy only, diabetes, right? And it may also prevail later on. So, which also means that sometimes there is a diet restrictions, maybe there are insulin, all of that may be happening depending on the extent, right? Hypertension also, again pregnancy induced hypertension, placenta previa. So placenta previa, what happens is actually the placenta is, so if you imagine the uterus to be the oblong organ, placenta attaches on the sides of the uterus, and from there the cord connects to the baby, the navel and all that. So now the placenta decides to attach closer to the cervix. Yeah, so that is called placenta previa. So what happens, imagine if it is close to the cervix and the head is over there and the head is trying to come out, it's very hard, and then there is an entanglement of the cord around the baby. I don't have a video. I will. There was one picture that I wanted to show, but it's that's how it is. So in those cases, the C-section is they usually do a cesarean. They don't try for a normal baby, and we've heard stories in those days where the kid.
They get choked inside.
Yeah, they get choked into the placenta, the cord and all that, because as the baby is trying to come out, it entangles and all of that. So that's why the placenta previa. Also in the prenatal yoga classes, we don't want to give a whole lot of squatting practices for them. So they may also get the lower abdomen pain and all that. So there are some symptoms. Nausea, vomiting, again we discussed that.
Can I ask, what do you feel about doing Baddha Konasana?
We will do all of that in the class. We will have a small session of.
It's helpful because then it helps us to open up.
Squats for placenta previa? For placenta previa?
No.
Generally. Yeah, butterfly for them is okay.
Yeah, I think I've done it.
Yeah.
Well, I have a caution because I miscarried in the 10th week and I was teaching a yoga class and I was in Baddha Konasana.
Yeah.
And it just,
Not artificial.
while teaching.
Oh God. Yeah.
So I actually never teach Baddha Konasana to a pregnant woman.
Well,
Because of my personal
yeah,
experience.
we'll talk about that. No, very good point. We'll get into those when we go into the
That is
session
more
itself.
late, like the third trimester, not in the beginning.
Third trimester is good. You should
that's
do
what I'm saying.
more.
Yeah, you do more in the not in the beginning.
Yeah.
Third trimester is first for the labor, you prepare for the labor. That time you do it, not in the beginning.
Yeah. Okay, so this is something I want you to look up these complications. Ectopic pregnancy we discussed, where the implantation happens in tube only and then it never comes down, and and it may burst and all that. So Rh negative disease, this is very important, where we discuss the separation, right? The membranes separate the mother, and so there is Rh. This is Rh negative and Rh positive. I want you to look it up. I'm going to leave it like that, but this is very interesting. That's why we said how does the membrane separate? Because the blood vessels, I mean the blood from the mother and blood from the baby should not mix up, right? That's something to look up, and there are some complications, some such complications that may happen, preterm labor and all of that. Okay, wonderful. So now come to your own mats, and we will do a prenatal yoga for the next.
One thing I want to add is on HB. So that one you asked that hormones is from placenta or hypothalamus. It's from placental hormones are section of this endocrine system. So it secretes two types of hormones, steroid and protein related. So like progestin and estrogen.
Estrogen and progesterone.
Placenta becomes a temporary endocrine gland during the pregnancy. So it's secreting all the hormones from placenta to take care of the whole pregnancy. So once everything is get prepared in the mother, then we go to the baby. Placenta becomes the temporary endocrine gland. Right?
Yeah, it operates on its own. Correct. Because imagine.
If you don't sleep last night from this, it needs to
Have a great trip.
Thank you.
Enjoy. I miss you.
What are you doing without you here? Stop.
See her short in the wedding.
Yeah.
She can miss that. For yoga.
Have fun. Sing a lot of sweets for all of us. Okay?
And now we are excited too because you bring sweets for us.
And she really advantage me.
That's a minor.
No, do we have more time because that rehabilitation is yeah, if we have time, then, what I'm going to say is 11:45 we will finish maximum 1 hour. And a few minutes of